Okay, I'm just going to share my presentation. Right, I hope you can see the first slide there. Sorry, so another back to basics session. So today I'm covering safeguarding children induction presentation for level 3 staff. And as you hopefully know, it's an intercollegiate document requirement. And the session's being recorded and the link will be shared in the newsletter. And the usual warning slide, if there's anything that comes up for you around abuse and or neglect, please do get yourself support and please do contact us, the safeguarding team, if you need to, and that's our details there. And this is a preview of the last slide, which will be a request for feedback. Just to remind you, there's no certificates, no record of attendance. We follow the intercollegiate documents and we encourage you to complete a reflection record. And the kind of things you'd put on your reflection record are what new things have you learned, how are you going to do things differently going forwards. And so if you can put those same things in the chat before you go, and any other comments or suggestions for the bite-sized sessions. So managing the safeguarding training needs of new staff. And I want you to go through, attend this presentation with 2 hats on. One is for your own knowledge, to upskill you to level 3, to reinforce what you already know and hopefully learn something new. But with your other hat on, if you're an employer or if you're a safeguarding administrator, you need to know this information for yourself, but you also need to know it so that you can pass it on to other staff. So you've got your 2 hats on, okay? And these are the intercollegiate documents, if you don't know what I'm talking about. There's one for children, one for adults, and there's an extra one for looked after children. So the role of the practice in safeguarding training for new staff. When you get new staff, you need to inform each staff member which level they are. And to remind you, the intercollegiate documents talks about 5 levels. We all start off at level 1. We move up to level 2 if we have regular contact with patients. So these will be your healthcare assistants and your reception staff, and also any members of admin team and secretarial staff if they have contact with patients, if they call them, if they discuss referrals with them, etc., then they come under level 2. And then level 3 are all the clinicians. And there are no level 4 in general practice, okay? Nobody needs to be level 4. Just for your information, I am a level 4 in my role as named GP and for the safeguarding team, and level 5 are the consultant paediatricians who specialise in safeguarding. So you've told the staff member which level they are, and then you need to give them their learning competencies, their tick tables, their reflection records, and their activity logs. And if you don't know what I'm talking about, then do email me and I can explain and send them to you. But this presentation is going to explain actually what these things are. So for new and existing staff who are all level 3, so that's all the clinical staff, if they've not done this in the last 3 years, tell them to do the level 3 adult safeguarding and level 3 safeguarding children. And they can do that on Bluestream, they can do it on e-learning for health, they can attend face-to-face sessions, or they can attend these live virtual webinars, they all count. And they also need to do level 3 preventing radicalisation and awareness of prevent. And they can only do that on e-learning for healthcare. So new staff induction, both intercollegiate documents, the children and the adults, state that all health staff should complete a mandatory session of at least 30 minutes within the first 6 weeks of taking up a new post. That's half an hour of children's safeguarding and half an hour of adult safeguarding. And this doesn't mean just putting them in front of Bluestream to do the safeguarding. This is separate from that. This is a specific session which covers the practices, policies and procedures around safeguarding. And also you've got to consider a person might be new to Birmingham, they don't know how safeguarding is done in Birmingham. Obviously safeguarding is safeguarding wherever you go, but the policies and procedures are going to be slightly different from town to town, city to city. So that's what you need to be telling them in this minimum of half an hour. So and you need to tell them that over 3 years we need to do 12 hours of safeguarding children, and if you're the safeguarding lead for the practice, you need to do 16 hours. And I'd recommend as well, for those of you who are safeguarding administrators, you would want to aim towards the 16 hours. And this is all in a page, it's a template, it recaps what I've just said about the hours for adult and children, and then it gives you a place to document all your learning. And then you can take that from job to job or show it to your employer every year. So here's the induction presentation. So this is a presentation to help you do that half an hour, minimum half an hour induction for your staff. And remember, you've got your 2 hats on. You're going to learn something about safeguarding yourself, and you're going to think, oh, this is what I need to be telling new staff when they join. Okay. And so obviously the presentation needs to be made bespoke. So there's certain slides that you've got to add your own specific practice information on. And also just to say, I've only got 25 minutes left to go through this. So I'm going to go at quite a pace, but normally a new member of staff would take at least an hour if you did it, with them, and it might even take longer. And this is what the presentation covers. And for those of you who are aware of level 1 and level 2, these are the only new things in level 3. There's only 5 things in level 3. Everything else comes under level 1 and 2 as well as level 3. Yeah. And these are when I was doing this level 3 presentation, these are 4 things that I noticed that actually they are relevant to level 1 and 2 as well. So for those of you who've got the presentations, please copy the slides out of this one when you get it and put it into your level 1 and level 2 as well, because they're applicable there as well. So why do you need this training? Safeguarding is everyone's responsibility. You can't run from it. You can't hide from it. You can't stick your head in the sand. You can't pass the buck. And this is one of the slides that you can put in the level 1 and level 2 training. Online safeguarding training is generic. This training is specific to the safeguarding policies and protocols of this practice. It's also specific to the safeguarding policies and protocols of the town or city in which this practice is located. And the intercollegiate documents for safeguarding recommend that you have induction training. So these are the 3 reasons why you're having this training. And this is the intercollegiate document. If you're not familiar with it, it covers your initial training requirements and ongoing training requirements over 3 years. The practice will notify you which level you are as determined by your job role, and all clinical staff except healthcare assistants are regarded as level 3. So let me just tell you a little bit about the documents. It's used for quality assurance by organisations like CQC, the ICS, ICB and GMC. So heaven forbid, if you had some sort of safeguarding disaster at your practices, this is what you would be used to benchmark against. So, you need to keep up to date with it. It also defines the employer's duty. If you're an employer, you need to tell all your staff that they need to do safeguarding training, and you need to be asking them once a year and checking that they are actually doing the safeguarding training that they need to do. It describes which level you are, and as I've said, this is for level 3. It asks you to gain attitudes and values, skills and knowledge, and work towards learning outcomes. And when you've achieved the learning outcome, you can claim to be competent in that area of safeguarding. It advises you to have induction training with every new job. It encourages ongoing training over a 3-year cycle. And regarding all safeguarding, records all safeguarding training on an activity log, so that you can show that in your appraisals, your NHS England appraisals, your in-house appraisals, and you can take it with you to new jobs. And as I said before, it encourages you to complete reflection records after each training rather than just showing a certificate. So this practice will provide you with your learning competencies, your tick tables, your reflection logs and an activity log, and this will be asked for at your annual in-house appraisals. Hopefully you're all doing these as part of CQC recommendations. And this is just a screenshot of the first page of the level 3 competencies. And then these are the tick tables. And this is an example of a reflection log. And let's just look how you fill it in. So obviously the name and the date, the title, and then 2-3 new things that you've learnt. And how does that relate to the documents of what you need to learn? So you can copy and paste from your tick table. And then what are you going to do differently going forward? So that's just an example. And this is the activity log, all you're learning over the 3-year cycle on a page. Obviously, this is just a suggestion. You can use any method you want, but I need to alert you to this column here called participatory hours. So when we fill it in again for today, let's say it took a whole hour to go through it, and you put down what you've learned, and this virtual webinar counts as participatory hours. So methods of learning for level 3, levels 1 and 2 can do all online, but level 3, 50% of those hours that I've told you that you need to do, the 12 hours for children, 8 hours for adult, has to be face-to-face or equivalent. So the equivalent means these kind of types of virtual interactive webinars, your safeguarding meetings with your health visitors, any safeguarding discussion that you might have at a clinical meeting, and any safeguarding audits you might do. So these are some examples of the kind of learning you can do. And you don't need to repeat the online modules every 3 years unless you want to, as a refresher for yourself. The idea is you do it once and you count that as time 0, and then you dip in and out of safeguarding over the next 3 years, increasing your knowledge on procedures within Birmingham and or Solihull and safeguarding needs local to the area you practice in within the city. So for example, I used to work in Nechells, and in the surrounding area, the patient population, there was a lot of female genital mutilation. So it would make sense for me as somebody working in Nechells to learn more about that condition. Yeah. And then the induction training. So within 6 weeks, you need to be doing this PowerPoint presentation. If you've never done level 3 safeguarding children, you need to do something on Bluestream, e-learning for healthcare, or if you can, a face-to-face or live virtual webinar. And you also need to do prevent training every 3 years. And if you've never done it before, you've got to do it within the first year of starting this post. And it can only be done on online for level 3 at the moment, and it's under the e-learning for healthcare. It's preventing radicalisation, awareness of prevent. They used to do them face to face, but since COVID, they've stopped doing that. And as I said, this is mandatory, it's statutory, actually by law. It's covered in the Counter-Terrorism and Security Act. So technically, if you don't keep up to date with prevent training, you could go to jail. And that's just a screenshot of the e-learning for healthcare under the statutory mandatory training. And then there's initial training, so any new member of staff new to a level 3 post. So technically that, again, that would include safeguarding administrators. If you've just stepped into that role, you've become a level 3, and also GPs who have newly qualified. They've just done their training and they're starting their first GP proper post. So really in that first year, they need to be doing 16 hours, minimum 16 hours of children's safeguarding, again, half of which must be face-to-face or equivalent. And again, over the 3 years, so in addition to that, in the first year, over the 3 years, they need to do 12 hours or 16 if they're the safeguarding lead. And again, that's the template. So let's move on then. So what is safeguarding? So the CQC definition is it's defined as the protection of a person's health, well-being and right to live in safety, free from harm, abuse and neglect. And straight away in the definition, we've got safeguarding and health and well-being. The idea is if we're working in primary care, we cannot properly look after our patients if we're not considering safeguarding, hand in hand. Why do we safeguard? We have a legal duty. So these are the key documents: working together to safeguard children, the sexual offences, rights of the child, Children's Social Act. These are all the legal duties. So we're not saying that you need to go in, read these, but you need to be aware that they exist and that they tell us what we need to do legally. Then we have a professional duty. Doctors have to follow the GMC, nurses have to follow the Nursing and Midwifery Council, and all other level 3s have to follow the intercollegiate documents. And we've also got the Human Rights Act as one of the legal duties. And then we've got a personal duty. I just want to put it to you. What would you do if you're in the supermarket and you hear a girl screaming and her mother is twisting her arm? Or you go on a home visit, or a family or relative or a friend's house, or somebody new that you're visiting, and you find that this little child is being made to sit on the cold floor, or this parent is severely berating their child. I hope that you would all intervene. So your responsibility in safeguarding is to recognise that a child or young person is being abused, or that the situation is abusive, respond to any immediate issues with the child or young person, and report your concerns as soon as possible. And you can't safely safeguard without professional curiosity. What is this? It's essential in safeguarding, and it's about not making assumptions and not accepting things at face value. Just think again, does that explanation make sense? Ask more questions, be nosy, be suspicious. Who, what, where, when, why, and how. And we've got to have the capacity to think the unthinkable and believe the unbelievable. We've got to be aware that some of our patients may behave a certain way in front of us as health professionals, but behind closed doors, they behave in a completely different way with their families. And there's 9 common themes for adults and children safeguarding that you've got to be familiar with: being aware of abuse, patients do have rights, and there's legislation to protect their rights, the impact of an adult who's struggling on a child, and the impact of a child who's struggling, the impact on a child who's struggling on an adult. Know when and how to make a referral to social services, information sharing, partnership working, documentation, awareness of professional abuse and what we call PPOT procedures, the significance of not attending an appointment, and female genital mutilation. So what does safeguarding children cover? A whole load of things there that you can see listed. Who does safeguarding children cover? So obviously, by definition, all children have care and support needs. They're all vulnerable. But what we can say is some are more vulnerable than others. So we think of factors in the children. What factors in the children make us worry about them? And I've listed them there. I'm not going to go through all of them, but for example, being under 1 year old, having prematurity, having learning disability, special needs, all these kind of things. And then we think about the parents. What factors in the parents would make us worry about the children? Obviously, if a parent has care and support needs, because if somebody is having to look after that parent, who is helping them look after the children? And other factors there, as you can see. And then think family. What factors are the family sitting within? Poverty, dampness, overcrowding, their neighbourhood, their ethnicity, religion, or sexuality that might make them, for example, exposed to, say, a homophobic attack, for example. And then we have the trio of vulnerabilities. If a child is sitting in an environment with domestic abuse, mental ill health and substance misuse, we need to put an alert on the medical records. That child is at risk. And if we throw in the fact that a child has a learning disability, we call it the quadrant vulnerabilities. And again, we must have an alert on that on the records. Child is cause concern, vulnerable child at risk. Every time that child comes in, we need to have an excuse to strip them down, check their body for any bruises, check their mouth for any signs of trauma, and do their weight, because weight is a very objective sign of whether a child is being neglected or not. So do their weight. So another way of saying that is think child, think parent, think family. So when we've got a child in front of us, we look at the factors in the child, then we look at the parents. What factors are there in the parents that would make me worried that is that parent capable of meeting that child's physical and emotional needs? And think family, as I've said, those factors, and then think carer. Sometimes children, even though they're children, they can be carers. Maybe they're caring for their younger siblings, maybe they're caring for their older siblings who have special needs, and maybe they're caring for their parents. So we need to know about that as well to support them. And here's a slide that the black asterisk indicates this should be in the level 1 and 2 as well. Risks in safeguarding are dynamic. What does that mean? It means that they can change moment by moment. So if you have a patient you know is in an abusive relationship and they've got mental capacity and they've chosen to stay in that relationship, every time you see them, you need to reassess their risk of harm because it can change. Then we move on to practicalities. Who are the safeguarding leads for the practice? So list them here, the lead, the deputy lead, and if you've got safeguarding administrator, put all their contact details as well. Tell the new member of staff that you've got a safeguarding children's policy. They need to read it, and if they don't understand it, who do they need to contact? And that you hold regular safeguarding meetings. Let the person know when are they held, who attends them, and what happens if they've got a patient they would like discussed at the safeguarding meeting. How would they go about that? And then coding, if you use a template, make sure they're using the template as well. Otherwise, make sure you're all using the same codes within the practice so that you can run searches if you need to. And when they're starting to work at your practices, how would they know that you've got a safeguarding concern about a child? When they open the records, is there going to be an icon? Is there going to be an alert on the manage box, for example? So let them know. And again, let them know if they identify a child who doesn't already have a safeguarding alert on them, what do they need to do? They need to code, and then how do they get them onto the safeguarding meeting? This is a level 3 slide, coding of female genital mutilation. All patients with female genital mutilation must be coded. And again, if you've got a template, tell them the codes are, though, female genital mutilation, history of female genital mutilation if they've had the procedure reversed, or a family history. So for particularly in children, female children whose mothers have had it done. So they need to be aware of that. That is a statutory duty. It's called the mandatory reporting, and have some information on that on your staff safeguarding board. And there's the number for the female genital mutilation helpline. And then patient access to their records. At some point, we don't know yet, so obviously you need to update this presentation when we do find out. Children aged 16 and 17 so it's 18 and above, but from 16, 17 are children, they will have access to their records. This is supposed to have benefits, so hopefully it would, but we've got to be mindful that it's not in the best interest of all of our patients. Some it will actually be detrimental. So some records may contain third-party data. And remember, it's not just the patient who's going to be checking their NHS app. There are other people in their lives, like the perpetrators of abuse, groomers, exploiters, who might use that information against them. So those kind of patients, we need to be adding this code, online access to own health record withheld, following enhanced record review. So all consultations by default are for online visibility. So, but the patient shouldn't see anything that's harmful. So every time you add something to the records, you need to think, can the patient see this? Is it okay to see it? So know how to remove an entry. So there's some screenshots for system 1 and for EMIS. So whichever computer you've got, obviously delete the other one. Then tell them I did not attend, was not brought, get them to watch this video, and hopefully you've all got policies now because CQC do ask for them. Tell them where the policy is and make sure they've read it and give them training in it so they know exactly what to do if a child doesn't attend an appointment at the hospital or the practice. Assessing GILIC competence, this is level 3 as well. Maybe you've got a template, so you can tell them about that. And GILIC competence is for children under 16. Again, remember, when they're age 16 and 17, we actually follow the Mental Capacity Act. So GILIC competence is for under 16. And child sexual exploitation, this is another level 3 slide. You may have the child sexual exploitation screening tool. Tell them about PACE, which is an organisation which supports parents whose children are being sexually exploited. And we also have our own sexual exploitation team within Birmingham, whose details are there. And then we have the West Midlands, what we call the SARC, the Sexual Assault Referral Service. It's run by Mountain Health Care, and if you've got any concerns, that's the number that you need to call. And so I should have put that's a 24/7 service. And then bruising in babies, they need to know the pattern of everyday bruising, non-accidental bruising. And remember, if it ain't cruising, it ain't bruising. In other words, if babies can't move, they shouldn't have bruises on them. And there's a little film that they can watch as well. And then they also need to know the pattern of normal bruising and non-accidental bruising. Then we've got the FIB form, the Forced Intelligence Bureau form. Any little snippet of information you might hear or somebody might tell you about related to anything to do with safeguarding, fill in this form and send it to the police, and you've done your civic duty. And you never know, that little piece of information that you overheard may actually help the police to solve a major crime. So what do I do next? Don't try and safeguard by yourself. Don't panic. Share. Don't be scared. So who can you share with? Give them a list of people that they should be contacting if they've got any safeguarding concerns, and encourage them to share information. The general principles are that we all have a professional duty to share information, especially when it comes to safeguarding. The 8 Caldecott principles, number 7, the duty to share information can be as important as the duty to protect patient confidentiality. And this, the GDPR is not a barrier to the justified sharing of information. And I want to remind you that no health professional has ever been in a court of law for sharing information, but lots of health professionals have been in a court of law for not sharing information, and because they didn't share, some harm came to a patient. So let's look at the process of children's safeguarding now. So social services deal with what I would say the tip of the iceberg. And this is because there's a threshold. We've got this concept of significant harm, and if it reaches that level, then they intervene. And so every town and city has a threshold model. So the one for Birmingham is called Right Help, Right Time, and the one that we're currently using is version 5, December 2021. And I haven't got time, obviously, to go through it in detail, but basically there's 4 levels of need. Green is good, yellow as well. Red obviously means make a referral to children's social services, and orange is that kind of in between. And this is how they can get the training on Right Help, Right Time. And if you've not done it either yourself, then do take time to do that. So the Safeguarding Children arrangements in Birmingham. Every town and city has a safeguarding partnership, and then the Children's Social Work Act say that there's 3 safeguarding partners in every town and city. So in Birmingham, it's always the ICB, it's the police, and it's the local authority. So in Birmingham, we've got the Birmingham City Council, but Birmingham City Council have subcontracted their safeguarding duties to Birmingham Children's Trust. And that's a screenshot of the partnership website, and that's the Birmingham Children's Trust. And you can see up there, you click on report a concern, and it will take you to the referral form. And so because Birmingham has so many children to safeguard and a finite pot of money, they've set up the Children's Advice and Support Service, or CAS for short. And we phone CAS, and the trained telephonist is supposed to answer the phone within 8 rings, and they can give us advice, or they can signpost and say, you phoned the wrong place, this is where you need to phone. Or they'll say, yes, you need to speak to a social worker, this sounds very serious, and they'll connect you to the social worker, and it'll go to what we call the MASH, the Multi-Agency Safeguarding Hub, with people around the table. And in between, we've got these 2 things, which I'll talk about in a second. So in Solihull, again, they've got their own threshold model. They call it the threshold guidance. And again, it's got 4, not layers, but levels. And level 4, the dangerous one, they've done a nice pink colour, but I prefer the red, which indicates that, you need to make referral to children's social services. And that's a screenshot of their partnership website. So I just want to recap, because Solihull and Birmingham are different. So every town and city has a local authority who is responsible for setting up this children's social services. So it's the council, the duty of the council to set up the children's social services. And what they do is they all have to set up a MASH, a multi-agency safeguarding hub. So that's true of both of them. The only extra complication of Birmingham is that in between, they have set up the Birmingham Children's Trust, who in turn have set up the CAS, the Children's Advice and Support Service, which is the gateway to the MASH. So it's a bit like primary care and secondary care. If somebody wants to go to secondary care, they've got to come through primary care, haven't they? So in Birmingham, if you want to get to the MASH, if you want to get to the social worker, you've got to go through the Children's Advice and Support Service first. Okay. So how to make a referral for Birmingham? It's the request for support form. You can do it online, or you can do it as a Word document if you saved it to your templates. This is the form, and the one you should be using is version 9, September 2021. And remember to always try and get consent if you can. And that's kind of the system on a page, on a slide, sorry, and who else you can contact. And if you're not happy with the decision or they've not taken it on board for some reason, you want to escalate, then there is an escalation procedure and get us to support you with that. And that's all on a page. I'll send you that document as part of the documents. So you can stick them up in your consulting rooms and your reception area. Same for Solihull. This is just a website link, and the form is called the Multi-Agency Referral Form, or the MARF for short. And you basically just click on all the links and complete the questions. And these are the key numbers that you need for Solihull. And again, if you need to escalate, you can do that. And that's all on a page as well. But remember, after making a referral, you do still have an ongoing responsibility for any referrals made. So if you've not heard anything back, give your email address for them to reply to you. And if they haven't, then chase them up. And then, so that was the social services. Now, the majority of safeguarding, though, actually sits under what we call early help. And remember this diagram, so this is the early help bit that I'm going to tell you about now. So this is about taking action to support a child, young person, or the family early in the life of a problem as soon as it emerges. So there isn't actually an early help place to refer to. We are all part of the early help team, but we've got people to help us. So if we've got children under 5 we're worried about, we can contact our health visitor. And if the child's over 5 and at school, we can contact the designated safeguarding lead. And early help is all about partnership working. Every agency working with the child and family have information, which we use, which we represent by a jigsaw puzzle piece. And it's only by putting all the pieces together can we see the whole picture of the life of what the child, what the life of the child is like. So we've got to be confident about sharing information, which I've already gone through. So in Birmingham City Council have invested millions of pounds in early help. We've got the Birmingham Forward Steps, who run the health visitors and the children's centres and other services for children. So make sure that your new member of staff knows about the health visiting team, that you've got an allocated health visitor, and that you're having meetings at least every quarter, if not more often. Who is the team? Who is the lead health visitor? Where's the referral form kept? So there's a screenshot of the website, the referral form, and health visitors also send us these liaison forms when they've got information for us. Then we've got the nursing service in Birmingham. We call it the School Health Support Service because there's not enough school nurses to go around. So you'll be part of one of 2 teams, North East or South Central. There's the website, there's the referral form, and then community connectors. So we've got all these areas of help that Birmingham City Council has funded. These are the 10 areas, so you can link up families in need with your local early help hub. There is also a Family Connect form you can complete. It does take a bit of time, so it might just be quicker to phone them. It's up to you. We also have the waiting room, which is a web-based app, and we can Google to find services for our patients. So for example, and it's kept up to date on a monthly basis, so there shouldn't be any old information. But if we click on supporting families, we get a whole list of all the NHS services, but also non-NHS services that we might not be aware of. So government funded, council funded, lottery funded, charities, voluntary organisations, everything there for Birmingham and Solihull. We also have the route to well-being. So this is a bit like the waiting room. It's got loads of services, but the advantage of this is you can put your postcode in and it will only bring up the services that are local to your area. And again, are covering a whole load of things: addiction support, dementia, sexual health and pregnancy, right down to youth activities. And for Solihull, it's a smaller area. So again, they have their health visiting team. There's the screenshot. They have their nursing service. There's a screenshot, school nurses. This is their early help document, which is on their partnership website. And they also obviously have the waiting room because it covers Solihull as well. Now, here's another slide for levels 1 and 2. System 1, and this is for only Solihull practices who use System 1. There's a safeguarding node, and the advantage in Solihull is Solihull MASH, the children's social services, the health visitors, and University Hospital Birmingham all use System 1. So you can see some of the information that they add if they add it to the safeguarding node, and they can see your information if you add it as well. So how would you know that a patient's got some new information on their node? They'll send a task to you, or you can run a search every week. The role of our team, the safeguarding team, this is another slide that you can put into the level 1 and level 2. It just explains what our role is, but we're here to support you, primary care, secondary care, everybody in the city basically who deals with safeguarding. And we also participate in safeguarding reviews, and we share learning and make sure that it is implemented. And what we don't do, though, is we don't accept referrals and we don't safeguard your patients for you. Some people, sometimes have the wrong idea. And there's the details that any new member of staff should put in their phones. Email us if it's not urgent, or give us a phone call. And then tell them about the packed safeguarding board for staff. When you've completed this presentation, please go and see the safeguarding board. It contains loads of important information. So when should you consider safeguarding? Always. And a summary: safeguarding is everyone's responsibility. Always have it at the forefront of your mind. Always show professional curiosity. Remember asking those questions: who, what, where, when, why, and how. Always ask about domestic abuse. Who's at home and what's the relationship like? Don't try and safeguard on your own. Share. Don't be scared. Get safeguarding induction training with every job. Who's the lead? Where are the policies kept? Where's the referral form? What's the social services set up? Remember, think child, think parent, think family, think carer, and never do nothing. If your alarm bells are ringing, please make sure you do something. So documents I can send you are the template for level 3, the bruising patterns, the one-page process for referring to Children's Social Services for Birmingham and Solihull. And please email me directly or put your email address in the chat if you need any of the competencies, tick tables, reflection records, activity log, or anything else related to this presentation. So thank you for listening. Just to let you know that we're having 2 weeks break now over Christmas and New Year. The next session will be Thursday, the 5th of January at 1:30. I'm going to cover types of abuse. And if you could do some feedback before you go, that would be lovely. So thank you for listening. I'm going to come out of this now and stop sharing.